Wonderful. Good afternoon, everyone. Hello, and thank you to everyone for attending the first of two May Housing and Security Learning Cohort webinars. My name is Alex Lewins-Wordling. I'm a consultant working with Root Cause on their learning cohorts, and I'm thrilled to introduce today's webinar. Following today's presentation, we will continue the conversation via Forum B. Several of you have probably been on there at this point, but it's our online platform that Root Cause has been using to share thoughts, perspectives, and resources with one another. If you need any help logging onto Forum B, please don't hesitate to reach out to myself or any of the Root Cause staff. Just quickly, in terms of housekeeping today, our speaker will present for about the first 30 or 40 minutes, and then we'll leave ample time for Q&A from all of you. If you have a question, please enter it into the chat box within the GoToWebinar platform, and I will field the questions as they come in. You do not need to wait until the end of the presentation to add your question. Also, following today's presentation, you'll receive an email from Root Cause with a link to a short survey to provide your feedback. So thanks in advance for taking a few minutes to complete it. And as always, you're encouraged to be an active participant on the Forum B site. Today's webinar will also be recorded and posted on the forum site within the week. So I'd now like to introduce today's fabulous speaker. Brenna McCallick is the Program Manager for Housing at AARP Foundation. She manages a grant-funded program designed to improve older adults' ability to age in place through preventive home maintenance. She's spent her career working to advance opportunity for disenfranchised communities and has previously worked at a Bay Area community development financial institution and an international education-focused NGO. She's a strong believer that addressing contemporary challenges requires a deep understanding of the past and holds a BA in history from the University of San Francisco and a dual MA/MS in international and world history from Columbia University and the London School of Economics. So with that, I will turn it over to Brenna. Brenna, thanks so much for joining us today.
Thank you, Alex, and thanks for all your work in coordinating, and Monique as well. Thank you, everybody, for joining today. My name, again, is Brenna McCallick, and I'm a Program Manager for Housing at AARP Foundation. I'm joined today by my colleague, Lisa Lanier, who's the Director of Research at AARP Foundation. And Lisa will not be presenting today, but she has graciously offered to be on the line in case there are questions that come up that I am not well suited to answer, as Lisa is our evaluation expert. So today I'm going to be talking to you a bit about how we think about data collection, both overall as a foundation and particularly with regard to our housing initiatives. So I'm going to introduce two of our housing programs, which are Here to Stay and Property Tax Aid, and then use those as models to discuss how we fold in data collection into our program design so that we can ensure we're capturing information about our participants that will allow us to know whether our interventions are making a difference in their lives, and also allows us to know internally whether we're meeting our overall foundation objectives. So next slide, please. So first, a bit of background for those of you who might not be familiar with the foundation. AARP Foundation is the charitable affiliate of AARP, and we serve both AARP members and non-members alike. We focus our programming specifically on low-income 50-plus seniors. So that means we work with people who are ages 50 and older. And we define low income as earning no more than 250% of the federal poverty line. And kind of a good reference for that is for a household of two, it would be earning no more than $40,000 a year in annual household income. So that's one of our differentiating factors with AARP is our focus is really on this low income segment of adults 50 and older. And then we work to end senior poverty by helping vulnerable older adults build economic opportunity and social connectedness. So next slide, please. Just a quick look at our vision, mission, and goals. We envision a country where no older person feels vulnerable, and we seek to create solutions that help older adults secure the essentials. I think that kind of really gets to the heart of it. And our goal, as I mentioned, is to increase economic opportunity and social connectedness. So those are our two main areas of focus across the board at the foundation. Next slide. So I wanted to talk kind of broadly about housing and how we think about housing at the foundation. This is some research that was pulled for us by the Urban Institute. So this graph represents some data on the low-income 50-plus population in the US, looking particularly at their sources of major expenditures. And that thick black bar in that graph represents housing. So we know that housing is the major expense for low-income older adults, and in fact, it represents across the board over 30% of expenditures for this population. And HUD defines being housing cost burdened as spending more than 30% of your income on housing. So we know that the population that we seek to serve is a housing cost burdened population. Next slide. So looking a little bit more deeply into actually what makes up housing expenditures, the largest expense within that category is shelter. So actually just paying your rent, paying your mortgage, paying property taxes, these represent the biggest expenses for this particular population, at least as of 2018. And so we all know that housing is a key social determinant of health. Where someone lives determines in many ways the kinds of services and opportunities that they can access. We also know that the actual physical structure of the home affects an individual's health and well-being. And we think about that in terms of both the safety of the home itself, as well as the costs of maintaining a home, of being able to stay in your home. So on the housing team at AARP Foundation, we look at housing in large part through the lens of economic opportunity, which, as I mentioned, is one of our two main areas of focus at the foundation. So we know that by reducing housing costs, we can free up funds that older adults can put towards other critical needs like healthcare and food. So that's sort of our frame of mind for approaching housing interventions at the foundation. Next slide. So the programs that I'm going to be talking about today were developed under our current strategic plan, which actually ends this year. And under that plan, the housing team was assigned the objective of achieving that a minimum of 55% of the people that we serve in our programs report an increase in their ability to age in place, as defined by an approved measure of effectiveness by 2020. So what that means, unfortunately, there is no definitive measure of effectiveness for aging in place at present. So unlike the Duke Social Support Index or the USDA Adult Food Security Survey, which we use to track the impact of our social connectedness and food security programs respectively, we can't yet systematically, with a proven method, track whether or not an intervention has increased an individual's ability to age in place. So I'll talk a bit more later about how we've adapted our program data collection and outcomes monitoring accordingly with this kind of lack of a measurement tool. The two methods that we use to achieve this outcome are used across the foundation. It's our innovation process where we develop new ideas for interventions in-house. We work with social entrepreneurs and put these interventions together and test them in the field. And then through our grant making or grant funded activities, I should say. Next slide. So before I get into kind of our housing intervention specifically, I wanted to take a step back and just talk about how evaluation works across the foundation and the roles that they play. So I think that's really important. And so this particular table came out of a framework document that was put together as part of our strategic planning process, where we thought really intentionally about how evaluation would play a role at the foundation across all of our program areas. And so I won't go into this table in detail because there's a lot of information here, but you can see that it lays out the different functions of our evaluation team across the foundation, from evaluating our own programs to informing our grant making policies. This is just to kind of emphasize that evaluation plays a role in every stage, especially in foundation-led programs, from early experimentation and developing programs all the way through to disseminating results and applying learnings. Next slide. So this is probably not a new concept to many of you, but I wanted to pause here just to go over the difference between output and outcomes metrics, both of which are tracked for housing programs. Um, and so outputs are numbers of units of a product or a service. And a major one that we track at the foundation is the number of low-income 50+ people served. But of course, output metrics don't tell us about whether an intervention has had the desired effect that it was designed to have. So outcomes, on the other hand, track whether the intervention had the desired results and produced some sort of change. So the example that we give here is for a food security program. An outcome metric would be the number of low-income 50+ people served who show a positive change in their food security status. And one of the functions of the evaluation team here at the foundation is actually to convene an evaluation working group that meets monthly to review progress on outcomes measures for foundation-led and grant-funded programs across the board. And this group is comprised of evaluation staff and program staff, but also individuals from our grants team, from development and communications. So all of these teams across the foundation are all in the know about kind of our progress towards meeting our goals. It's also a great opportunity for us to surface challenges from a data collection and analysis standpoint that affect any one of these programs, and usually more than one program, and we can kind of talk through those issues and those opportunities. And so it's been a really great asset to the foundation. Next slide. So aside from outputs and outcomes, another set of factors that we measure are demographic characteristics of the people that we serve through our programs. So we call these characteristics our special six, as there are six that we try to gather from participants in foundation-led and grant-funded programs. So these are age, gender, ethnicity, race, household size, and household income. And these measures help us understand our target population, and they help us determine whether we're actually reaching the people that we intend to serve. So they're really important for informing a lot of our program testing and development. Our evaluation team has standardized the set of questions to ask about these particular traits, but the ways that these questions are administered in different programs differs. So in some cases, people who receive a service are filling out a paper survey. Other times they're responding to a survey online. Other times they're contacted by phone as a follow-up to receiving a service or participating in a program. So what we found works best in terms of user experience is, to the extent possible, to fold questions into the actual user experience whenever possible. So making asking these questions, these demographic questions, part of the overall process of experiencing the program. The other thing that I think is really important is communicating to people directly about why this information matters to us. So the process of asking these questions of participants, as I think a lot of you who operate programs are probably familiar, can be challenging. Some individuals don't necessarily want to share information with us about these aspects of themselves. Especially we find working with older adults, people can be wary of why the information is being collected and how you're going to use it. And so we really take that seriously, and we really make sure that we have practices in place to communicate to people that, first of all, that all of these questions are optional. They do not have to tell us any of this information if they don't want to, and that their responses will be kept anonymous and analyzed in aggregate, and really help us just to improve our ability to reach people and to know, how to serve people better. So our evaluation working group has actually been recently examining these special six questions across our programs, and we've found that we actually have a fairly high response rate, even though these questions are optional, to most of the questions across our programs. There does seem to be a slightly higher response rate with in-person programming, as opposed to web-based or digital tools where there's less of an in-person interaction between a participant and like a program administrator. So that is something that we've learned from that process. So go ahead and go to the next slide. And before, this is the kind of the last thing I'll talk about before we get into specifically housing programs. But I wanted to pause and talk a little bit about our grant funded activities, just because the programs that I'm going to be talking about, one is an innovation concept and the other is built out of a grant that the foundation actually received. So I wasn't going to get the chance to talk about a grant funded program. So wanted to just kind of talk through the role of evaluation and the way that we fund grants. So last year we had 2 evidence-based solutions grant competitions, and we look to support organizations that with our assistance can roll out solutions to help low-income older adults increase their economic opportunity and decrease social isolation. So we fund in interventions that are evidence-based, but at various stages of development. So while we do fund grants for education and outreach and field building, most of the types of grants that we fund are direct service. So they're either ready to pilot, ready for outcomes, or ready for scale. But either way, they have a certain amount of evidence that can back up the intervention. And so the evaluation team works closely with our grants team on a rigorous review process to review the level of evidence submitted with each application, and then they author an opinion letter on the grant applications that are selected. Okay, can move on to the next slide. So now I'd like to talk in particular about 2 housing programs and how we think about data collection as a part of building the program and of course executing the program and improving on it. So the first is an innovation concept called property tax aid that has been operating since last year. And this innovation came together as a result of a recognition that there are a number of property tax relief programs that exist specifically for low-income seniors across the country. But there's a big gap in awareness of these programs, and they're underutilized in many cases. And that's particularly because a lot of these programs are not very well advertised. But there's also the challenge that actually applying for these programs can be pretty onerous, and filling out tax forms is, not always something that's very easy or straightforward for anybody, but let alone, an older adult. So we wanted to design an intervention to kind of meet this need and fill this gap and tap into this largely, untapped resource. And so property tax aid is, I describe it a bit like TurboTax. It's a digital tool that we put together to streamline the process of finding out whether you're eligible for a property tax relief program in your state, and then actually filling out an online application that turns out a printed application that you can then mail in and hopefully receive a refund. So property tax aid has, this is I should say, a screenshot from our homepage for property tax aid, and it's built as a platform for volunteers to use to guide older adults through the process of finding out if they're eligible and then applying for the programs. So we've benefited at the foundation from the fact that we have a very large existing tax aid program. I think it's the 3rd largest tax preparer in the country. So every year, thousands of volunteers across the country work to help older adults file their taxes. And so we have this existing infrastructure, and one of the goals with PTA is to use that infrastructure to expand this additional opportunity to older adults and hopefully generate some additional savings for them. And so the goals of PTA are kind of threefold. So first off is just increasing awareness of property tax relief programs, because we do know that there is an information gap there. And then of course, determining eligibility for relevant programs, and then assisting older adults in actually applying and filing those applications. So from a data collection standpoint, some of the highlights, I think, of what we've been able to do with this program is we've folded the demographic questions that I talked about earlier our special six, into, in some cases, into the intake process. And it kind of differs depending on the setting of the property tax aid site. But generally, older adults are already having this conversation with a volunteer about what they've spent on rent or on mortgage or on property taxes, and then what their income is. And so there's already this conversation happening, and folding in those additional questions and communicating what that information is going to be used for. That's kind of a seamless process. And so it's been that's been an effective way of kind of quickly gathering information as part of this user experience. Bullet points here 2 and 3 are kind of connected. So output data, and I'll talk about the outputs that we collect in a minute, is collected automatically and then stored securely, but the tool itself does not hold on to any personally identifiable information and financial data. So actually at the end of an application, once someone's completed an application and it's printed out for them to mail in, that all of their information is automatically deleted. So none of that personal data is saved on any computer or anything like that. So we really wanted that to be built in to protect the security of the older adult. And then finally, the Net Promoter Score question is asked at the very end of the user experience. Next slide. So this is a look at the property tax aid logic model. It's a little simplified. And one of the things that I think is important to note is that logic models can change. And so for property tax aid in particular, we're kind of reevaluating our targets at the moment with some of the pivots that we've had to make as the program's gone along. So that's why there's not particular set numbers in a lot of these right now, but this is just to kind of show the way that we think about change and impact overall with property tax aid. So we have all of our inputs on the left. You know, we look at our foundation staff, our state offices, our volunteer network, the actual digital tool, the training provided to volunteers to be able to administer the tool, all of that in our inputs, our resources. In terms of our activities, we look at both the training volunteers in order to be able to provide the service, and then the actual volunteers working with low-income older adults, helping them through this process of applying for tax relief. And so from an output perspective, in terms of kind of what we count, we look at the number of low-income older adults who are able to use the eligibility screener, so to meet that first need of just finding out whether or not you're eligible for these programs, and then the number who actually go through and use the enrollment wizard and complete that process. And then, of course, we track cumulatively the projected benefit to the participants. So we can't guarantee that people are going to receive a refund, because, of course, that has to be decided by the state, by the tax board. But we have an ability to, within the tool, project what the older adult is likely to receive back. And then we calculate those amounts so that cumulatively we can get a look at the projected benefit to the people that we're serving. And then in terms of outcomes, in the kind of immediate term, we look at the percentage of low-income clients who are increasing their knowledge of property tax relief programs. So that's something that we can ask them at the outset, what their level of knowledge is of property tax relief in their state. And if, you know, they, at the end of it, if they feel comfortable, like they can talk to a friend about it, and now that they know that this program exists. And then we also look, of course, a short-term immediate kind of outcome measure is people who are able to successfully complete an application. Intermediate outcomes, we were planning to start collecting this data this year, because this will be the second year of operating property tax aid, but we have had to postpone our rollout for this year given the current realities. We were able to, and I'll talk about it in a minute, we were able to operate some of the program earlier this year, but of course we're not expanding to the extent that we initially planned. And the outcomes that we're tracking in the kind of medium term are around seeing whether people received a benefit, and then what they put that money towards. So that necessitates people returning to a property tax aid site a second year, We ask participants if this is their first time, because of course we don't keep their information, so we can't track who's coming back. They have to tell us if this is their second time or third time. And then we ask if they've received a benefit, and if so, if they're comfortable telling us how they spent the money. And so from some very, very preliminary data from kind of initially rolling this out, it does appear that people are using refunds that they've gotten to put back into their homes, so to actually pay bills or to pay their rent or their mortgage. So that is the goal, is we want to see that people are using this savings to put back into their homes in order to continue to stay in their homes over time. So really the theory here, again, because we can't definitively measure whether or not someone is actually aging in place, we look at cost savings. We try to establish whether individuals are lowering their cost of just continuing to stay in their homes. And that's our proxy for the aging in place outcome, which is our ultimate goal, is that people are able to stay in their homes for as long as they want. Next slide. So this is a quick kind of summary of our outputs and outcomes from property tax aid. In 2019, the program was launched in New Hampshire, Minnesota, and Washington, D.C. Over 15,000 people were served, and the cumulative projected benefit to people was around $7 million, which is very exciting. In 2020, again, we've had to halt our operations. We were intending to launch the program in 10 new states this year, but that has been postponed. But still, with the tax sites we were able to operate at the beginning of the year, we served about 3,200 people, generating a projected benefit of about $550,000. So again, for our outcomes measurement, we don't have a definitive measurement tool for aging in place. So we're trying to look at a kind of medium-term outcomes, and we haven't been able to start collecting those this year. But again, just kind of want to emphasize that the theory behind this and the change that we are hoping to see is that this program reduces housing costs for low-income older adults. And the theory behind that is that that will then free up funding for other essential needs and make it just easier for an older adult to live in their homes. Next slide. So the other housing program that I'm sharing today is the program that I actually have the privilege of managing, called Here to Stay Home Upkeep for All. And I realize I should have put the website on here, but it's heretostay.aarpfoundation.org. And Here to Stay is a two-pronged program. So we have an online resource center around preventative home maintenance tools and advice for low-income older adults. That's on the one side. And then we also have collaborated with Habitat for Humanity over the past couple years to offer place-based in-person workshops for seniors that are built around this idea of preventive maintenance for staving off some of the worst problems that people see in their homes over time. And if you neglect maintenance, there's a lot of potential disasters that can happen, potential really big fixes and repairs that you need that potentially can displace people from their homes or make their homes really unsafe. So the goal of the program, across our online and our place-based components, is to increase knowledge of the benefits of keeping your home in good shape and keeping a regular home upkeep routine, to really focus in on the tasks that are critical for aging in place. And to that, a lot of the research that we did that went into building all of these resources was focused around identifying those tasks that are really essential for someone to stay in their home over time, because there's a whole universe of things you can do around your home to keep it in good shape. But given older adults, especially low-income older adults, limited abilities or limited financial capacity to handle a lot of major upkeep, we wanted to focus in on just those tasks that are really essential for staying in your home over time, making it a little bit more manageable for older adults. So that's a big component, is just kind of driving home what's really essential. If you can do nothing else, just do these things and and you should be able to stay safe in your home. And the other component is really driving home ways to access free or low cost and just across the board reliable service providers. So I should mention our website has what we call our Here to Stay toolkit, which is a 80-page document. It's free. It's available for download online, and it's full of information about what to do in order to stay in your home, when to do it, what projected costs are, how to budget, how to find reliable contractors, how to access local government programs, maybe that do home repairs for seniors or modifications. So all of that available in this resource, and that's sort of been kind of the backbone for the whole program. So really, really education focused and trying to drive home all of this information for low-income older adults. The other major goal of the program, in addition to increasing knowledge and awareness, is to increase confidence. So we really try to make home maintenance less intimidating for seniors and make sure that they know that this is something that's manageable, and if there are things that are not manageable, there's always help. There are ways to get help, and it's all doable. So with those two aspects of our program, data collection is kind of interesting because we have a web-based service and we have a place-based service. So it's been sort of an education in tracking outputs, and in the case of the place-based workshops that we run, tracking outcomes. And the website in particular, as a service, as a resource for information for seniors, has presented some interesting challenges from a data collection standpoint. And as I mentioned, across the board at the foundation, across our programs, we track the number of low-income older adults that we serve. And so we've had to think a lot about what it means to serve someone online, and how do you provide a service online that's a meaningful thing for an individual. And so this is an area where I've been fortunate to work very closely with our evaluation team. We knew from the outset we didn't want to just report, okay, we've had this many impressions on our website, we've had this many unique visitors, so that counts as people served. And we knew that isn't actually a meaningful data point in any way. And so we worked with our evaluation team to determine what qualifies as what we call a meaningful engagement online. So it's really types of activities online that demonstrate that somebody sees value in the resource that you're providing, and that they've kind of taken an extra step to show that they're engaged. And so a couple of examples are, we have this downloadable guide online, and so there's a requirement to enter your email address before you download it. And so we look at if people are actually willing to give us their email address and go through the process of downloading this guide. We take that as more of a meaningful engagement than just somebody reading an article or something online. And another example is we have a personal assessment on the website. So you can go through and answer questions about what you do around your home from a maintenance standpoint, and then you get tailored feedback based on your answers. So recommendations for things you could be doing better or more frequently or things like that. And so if people take that questionnaire, they fill it out all the way, and then they go to the extra step of downloading their results or sharing them with a friend or emailing to themselves, we take that as a meaningful engagement, as somebody has been served by our program. So that's been an interesting learning curve. It's kind of an imperfect science and we're still learning, but that's been a good learning for me, especially as a program manager, to think about, as a lot of our programs are going online, especially now. How do we effectively measure people's engagement with those programs and whether they're actually getting a benefit from what we're putting out there? So that's been a really useful process. And then we have demographic surveys on our website, and we ask for an NPS score. That has been also an interesting learning for us, because we see a gap between the number of people who participate in our place-based programming and fill out these forms versus the people who are engaging with us online. There's a lot fewer of them as a percentage who are willing to give us information about themselves, give us feedback. I think there's a general kind of antipathy towards online surveys in general that we're fighting against. But there's also just, I think that because there's less of a in-person interaction there and it's more of a transactional interaction, we see lower response rates. People are just not as willing to take the extra time to tell you about themselves and give you some feedback. So that's been an interesting learning and trying to figure out how we optimize that for people. Again, trying to make it seamless with the user experience so it doesn't feel like an added thing that they have to do. And then on the place-based side, we track outputs and we also track outcomes. So the ways that we do that are very different, obviously, from our online component of the program. And we offer at these workshops that are hosted by Habitat for Humanity staff in various communities. People who attend the workshops are given a paper survey to fill out with an NPS score. The Habitat staff person who's hosting the workshop will explain to them, what the point is, why we're asking them for this information, and they provide that data for us. We also have, at the beginning and at the end of every workshop, in order to gauge learning, we issue a quiz. And it's the same set of questions at the beginning and at the end. We just change the order so that people aren't remembering their answers from the first time around. And we intended to use that as a way to gauge learning, but actually what we found is that in the first year of operating the program, the questions were too easy. And a lot of individuals got 100% on both quizzes, or in some odd cases, people did worse on the second quiz. And so that was a learning for us that, okay, this is probably not quite calibrated correctly to the actual content of the workshops. And that's the feedback that we got from the workshop hosts. They said, we, rather than focusing on the what of home maintenance, we really tend to focus on the why. So rather than asking how many times should you change your air filters, it's posing the question to people of why is it important to change your air filters. So we revamped the quizzes this year and we were intending to roll them out, but of course our programming has been halted. So we haven't been able to do that, but that was an interesting lesson for us. Lots of good lessons from this process. And then finally, we have, for a medium-term outcomes measure, we have the Habitat staff who are hosting the workshops follow up with people 1 to 3 months after they've attended to check in on them and see if they've done anything differently in their homes. And also to see if they feel more confident about, taking care of home maintenance on their own and then finding help if they need it. Next slide. So again, a look at our logic model. We have all of our inputs on the left. Again, I should say this is for our place-based work only, our work with Habitat, as we aren't tracking outcomes on the website. So Habitat, our grantees, are a part of our inputs and their relationships with local businesses and their ties to the community and all of the things that they can bring to offer these workshops. From an activities standpoint, the goal this year was to expand to 7 different communities, offering these workshops in 7 different states in 2020. We started out offering 3 workshops in 3 states last year, which was very successful. And this year, of course, we've had to kind of slow or halt, I should say, our expansion. So originally the goal was to reach 500 low-income older adults across these 7 communities. We will likely not hit that goal this year, so we're rethinking that. In terms of outcomes, as I mentioned, we're measuring whether or not people are increasing their knowledge and whether they're, of home upkeep tasks themselves and the benefits, and then also of how to find help. Medium term, that should say 1 to 3 months post-workshop. Following up with phone surveys, asking people if they've done anything differently. The goal is for us to see that at least 50% of the people who are surveyed have taken in some sort of action, or that they feel like they could in the future if they needed to. And longer term, again, absent a measure of aging in place, we still have to kind of think through how we'll evaluate this, but we would like to see that people are actually taking action as a result of participating and that they're taking what they've learned and applying it, and that it's actually improving their ability to stay safely in their homes for as long as they'd like to. Next slide. So another summary of our outputs and outcomes to date. In 2019, we launched the workshop portion of the program in Maryland, California, and Florida, and we're able to serve, sorry, there's a siren going by. I'll wait for that to pass. So we were able to serve just over 200 people across those 3 states last year. And then with our website, in terms of those meaningful engagements that I mentioned, we were able to engage over 16,000 people. And that was really after ramping up a lot of our outreach, a lot of our marketing towards the end of the year. So in 2020 already, we've been able to get over 14,000 people engaged online. That's mostly just in the first quarter, which is pretty exciting. We were supposed to expand our workshops into 4 new states, South Carolina, Michigan, Wisconsin, and Kansas, but we had to halt those until it's safe again for older adults to gather. And we were able, before I think everything kind of hit crisis mode, we were able to host at the very beginning of the year 2 initial workshops that engaged 23 people. So that is our count for 2020. And then from an outcomes standpoint, this is a screenshot of one of the questions on Qualtrics, which is the platform that hosts this follow-up survey. And so again, these questions are administered by a Habitat staff person who follows up with a program participant 1 to 3 months after they've attended a workshop. And we were able to get some early outcomes data by the end of last year. So this is all data from 2019, and we were able to survey 35 people. So of those people, we found that over 50% had completed a task by themselves since attending a workshop. 43% had found outside help doing something around their homes. And then what was really exciting is that, almost 3/4 had expressed greater confidence in their ability to tackle home maintenance challenges around their homes by themselves. And then 89% said that they were more confident in their ability to find help if they needed it. So those are some exciting early indicators for us that we're getting where we need to go. Next slide. So to sum up, I just kind of wanted to highlight best practices that we've kind of pinpointed as a foundation, and that I hope I've communicated throughout this presentation. Some of the things that we really recommend are involving evaluation as a member of the program design team. So really keeping evaluation at the table from the outset, making sure you think about how data is going to be collected at every stage, and building that into your program operations is really crucial. Again, making data collection as seamless as possible to the extent that that's something you can do, making it really keeping in mind the user or the participant, and just knowing that nobody wants to do extra work and report extra things on top of an experience. So folding that into the experience as much as possible is best practice. Using proxy measures where standard measures don't exist, which is what we've had to do in the housing team with, kind of absent this definitive measure of aging in place. We look at cost savings and abilities, levels of comfort in staying in the home, with regard to aging in place. So we also recommend using a really rigorous standard framework for evaluation, which is something that we did that really lays out the role of evaluation within the organization. Convening the evaluation working group has been huge. Having that cross-team, cross-disciplinary conversation once a month has been really valuable. It's allowed us to surface challenges and also just keep everyone aware of where we are in our progress towards our goals. And finally, as a sounding board for the evaluation team, it's really valuable. And then the last thing is examining the state of evaluation every year. That's something that our evaluation team does, kind of take that time to reflect on where we are with tracking our outcomes and our outputs. Last slide. So I wanted to just comment briefly on kind of our response to coronavirus. We have been able to mobilize pretty quickly around this challenge, especially as older adults are some of the most vulnerable people during this time. We launched a rapid response innovation process right at the outset, and we were able to put in place a program of sending emergency food boxes to seniors at affordable housing developments that we work with. And now we're putting in place a system for people to actually call and request food, and we're kind of systematizing that. On our workforce programs, we offer a number of programs to help people get back into the workforce or to develop new skills. And those programs are really crucial right now as so many people are out of work. And so a lot of that work has been put online. It was formerly a lot of workshop-based interactions, and now we're making that virtual to the extent possible. From a social connectedness standpoint, we have a wonderful resource called Connect to Effect. It's another online platform that connects people to resources for fighting isolation. We've expanded that, added new features, kind of upgraded the interface, and that's something that's now really available for people who are in kind of crisis and especially isolated now. AARP launched Community Connections, which is a way, provides support for people who want to start mutual aid groups in their areas. And finally, for housing security, we are developing virtual programs. We're thinking through a way of taking property tax aid, which is place-based, and making that more online. So that's in the works. And then working with Here to Stay, trying to create more guidance around staying safe in your home as people are, basically stuck at home these days, and how to feel safe while you're home. And from an evaluation standpoint, we're pivoting our in-person data collection. Of course, that type of data collection can't happen right now, so thinking through some alternatives. And then just really being mindful of the effect of this crisis on on our data collection processes, and working to capture what's happening to people that we're serving during this time, because there's a lot to be learned from this particular crisis. So I think I went a little longer than I expected, but we still have some time. So if there are questions, I would be happy to address them. And thank you so much for joining today.
Brenna, thank you so much. That was a really wonderful dive into your programs, as well as some of the higher level learning. So I hope that the attendees, and I'm sure they did, find it really valuable. There are a couple of questions that came through in the chat box. So I'll just start with the one that I think is really interesting and relates to more of the end of your presentation, which is what components are essential when developing a framework for evaluation?
I think I might actually defer to Lisa on this one, as I was not involved in that particular process. Lisa, do you feel like you could speak to that?
Oh, yes. Oh, can you hear me?
Yes.
Yep.
Okay, great. Oh, excellent. Yes, so the evaluation program has been in place at the foundation for, it's about 7 years now, and it really starts with a commitment from an organization's leadership team, and the foundation has invested in evaluation and believes in it. And so in terms of a framework, it's providing some guiding principles, as well as laying out the various, as Brenna showed the table, kind of roles and responsibilities, and how we interact with all of our colleagues in the foundation, and setting up a process in terms of how we go about evaluating particular internal programs, going back to determining the place in which a program is at in its development, and identifying that we will conduct evaluability assessments to be mindful of our resources, to ensure that we are evaluating the program when it's right to be evaluated, and that we're determining whether it's an effective use of resources to do evaluation work internally, or to contract out for it, or have a combination, and determine what is the most appropriate type of evaluation given the where a program is in its development. So there are a lot of pieces that are put together to develop that framework, which is an evergreen document, and our state of evaluation is something that we update every year. As Brenna said, we take a look back and see what our activities were and what we are going to do moving forward in light of the strategic plan that we're working under.
Super, thanks, Lisa. That was really helpful. I think a related question is one about logic models and who either within AARP Foundation or outside, in terms of your process and perspectives that are gathered, aid in the establishment of your goals and outcomes when you're developing a logic model.
Brenna, do you want me to take that?
Just, from my experience building a logic model for the Here to Stay program, it was really a process of researching, just doing a lot of desk research of existing literature. There's a lot of information out there on older adults' struggles with home maintenance. And there's a lot of literature, I should say, on the connection, of course, between housing and health. It's a little bit more sparse in terms of home upkeep and health. So I just did a deep dive into a lot of the studies that are out there and to back up what our hunch is, which is that if people take better care of their homes and make it more of a routine and take especially preventative measures in their homes to prevent major repair needs down the line, that will logically sort of aid them in aging in place. So there's that research component to it. We also had the benefit for about a year in working on Here to Stay of doing like site visits and interviews and working with experts to really understand the contours of this problem. So as I mentioned, this is a grant funded program. It's a grant that we got from the Hartford. And so obviously there's a big concern as an insurance company on people taking steps to prevent disasters in their home, and a lot of their agents and their specialists actually are very knowledgeable about the types of problems that they see most often. And so we engaged with them to try to understand the need. We worked with Habitat for Humanity because they're on the ground repairing homes, building homes, working with older adults in a lot of cases. And so we talked to them about the challenges that they see and the types of interventions that they'd like to see and where they think the gaps are. We also worked with an economist who's based at the University of Cincinnati to just look at the numbers and see, like, over time, how much will this cost people if they don't maintain their homes, and how much does maintenance cost year over year. So we did a lot of that initial research, and it wasn't necessarily with the intention of informing the logic model, but I think that that's really critical because we had a set of assumptions going in about what would be effective with this population. And then, of course, I worked closely again with Lisa, with the evaluation team. This is the first time I built a logic model, and so it was really important to understand how to think about this at kind of every step, especially in terms of outcomes and the timing of certain outcomes. So I would just say, engaging experts who are subject matter experts in the area where you're intervening, and then working with people whose specialization is data collection and data evaluation. That's, I think, how you kind of build a successful model.
Thanks, Brenna. And just last question, I think we'll wrap up with this one. Do you, either Brenna or Lisa, do you have recommendations for resources or organizations or practices that individuals that are listening in could look to help inform their work if they're in the early stages of trying to identify their monitoring and evaluation approach?
Yeah, I might also defer to Lisa because I think she probably has some coming to mind.
Yeah, so the American Evaluation Association is a good resource. They're the organization for evaluators, and they do have a lot of resources. Also, it's the nonprofit focused on effective organizations, and I could, the name is escaping me at the moment, I apologize, but I could perhaps provide that to Alex or Monique and make that available. They have a lot of resources on evaluation at nonprofit organizations. On the foundation's website, when we do have like our resources for our grantees, and you'll see there are templates for logic model, theory of change, and output and outcome data collection plans. And I'm open to anyone contacting me at the foundation to have any more in-depth conversations about how we started and how we do evaluation at the foundation.
That's great. Thanks, Lisa. Super helpful. And maybe Brenna, if you have a chance to post any of those resources on the Forum B site, then people can just click there and access some of those organizations. So I think with that, we will wrap up today. I want to thank both of you guys. This was a really, really insightful presentation. And again, it will be posted on the Forum B site along with the audio recording. So thank you everyone for participating and enjoy the rest of your afternoon.
Thank you so much.
Thank you.